To the cancer patient, it is important never to lose hope and important to live every day to its fullest. For the cancer doctor, it is important to respect your patients, to treat them as fellow human beings, almost to treat them as your own relative, offering them the best advice to improve their chances of beating this dreaded disease. To me, one of the mistakes that's often made is the panic that the patient feels when they are first diagnosed with cancer. It is this feeling that, oh, everything must be done immediately. I have no time to think about it. I have no time for a second opinion. Rarely is that the case. Indeed, there are situations where there is need for urgent surgery, where you may not have an opportunity to seek a second opinion. However, in most cancers, it is often good to take time out, to almost have a period of cooling off, to think about the options that have been presented, to hear different views in order to decide what is most suitable for your particular cancer. So step number 1, don't panic. Number 2, it is important to have a good relationship with your doctor, to be able to ask questions and have these questions answered. All too often, the doctor is seen like a god, that he can make no mistakes, that he's too high up for you to ask questions. It is important as a doctor to answer these questions so that the patient understands what is going on and cooperates with the management. With this, a strong understanding of the disease and a good relationship, that is the secret to a favorable outcome. There are such things as treatment protocols, but treatment protocols have largely been based on research specimens. These are patients who have participated in research and a certain protocol has been adhered to and the outcome has been made known. But in real life medicine, it is not so simple. It is very important to assess each patient as the treatment goes on. That's why it is important not to treat patients as digits, but rather as individuals. Treatment has often to be tailored and adjusted based on the toxicity profile and dependent on the fitness of the patient. That's why it's important that when a patient is being treated, the patient is being treated by a doctor who takes an interest in his or her well-being, rather than to just follow a protocol and to delegate treatment to others. It is important that each patient must have his or her own oncologist, his or her own doctor. As a general rule, it is always good to have a patient who fully understands what the situation is. However, there are exceptional situations. There are some situations whereby the patient may be frail or may not be psychologically prepared at that stage to know the real answer. This is something whereby a doctor has to judge. When I was a young doctor, I kept to the ideal of saying that every patient must know everything before we start treatment. But as I mature, I realize that this sometimes is not in the best interest of the patient. Sometimes it is necessary to tell half-truths in order to motivate the patient to receive the treatment, and only as time goes on to gradually tell the patient what is really happening. With this, it is important that patients and the family must understand that how much we tell, when we tell, how we tell, is really in the best interest and not in our best interest. As I've said before, the goal must be something that is realistic. It is unrealistic for a patient to ask for a cure when indeed there is no cure that is possible. That's why it is important for the doctor at a very early stage, in the early interactions, to explain to the patient exactly what is going on. It is only through understanding and setting of common goals, realistic goals, that you can get the cooperation of the patient and the family. It is important from the very beginning to be honest with the patient, to establish what are the likely benefits, the toxicities of treatment And what are the goals of management? To treat a patient with a curable cancer and to treat a patient with a cancer that cannot be cured is different. In a patient where cure is the final objective, we are often willing to accept a certain degree of toxicity because the outcome at the end of the day is really trying to cure the patient and prolong life to a ripe old age. However, in treating a patient with stage 4 cancer that is not curable, then the goals are different. It is to control the disease, to preserve the quality of life, and to extend life. We should never treat a stage 4 patient to a point whereby toxicity becomes unbearable, whereby the patient finds that even though life can be extended, life is not worth living. That's why it's very important to have this conversation with the patient to understand the goals, and so that the treatment is not futile.